it safe to get pregnant right now?
Yes, see, I think actually there's going to be a baby boom in 10 months down the line, because there have been so many conceptions the world over because of this lockdown. Okay, so now we have evidence to tell us that a lady who is pregnant is not at greater risk of getting COVID infection. That's one thing. The second thing is, if a lady is pregnant and gets COVID infection, she's not at a greater risk of dying or becoming critically ill. That's the next thing we know. They behave just like non-pregnant individuals who get COVID. Now, there's an interesting study which was published very recently that involved 427 women, all pregnant, and all of them had COVID. And this study was done in the United Kingdom. And they found that certain risk factors, for example, if the mother was over 38 years, if she had diabetes or hypertension, if she was obese or overweight, then she had an increased risk of becoming critically ill. And critical illness occurred more commonly in the third trimester, that is after 28 weeks. Another very, very important finding in the study was that women who belong to BAME, that is Black, Asian, and ethnic minority groups in England, were more likely to become critically ill. And the one common factor in all these people, which they found, was all these women had low vitamin D levels. So we know we have some evidence to say that vitamin D deficiency can be linked to respiratory infections. So as Mangalam said, this is some more evidence to say that vitamin D needs to be supplemented in women who have vitamin D deficiency. So it's very important from this study. Another thing is regarding pregnancy is, which people need to know, is if they do get COVID infection, they have to drink plenty and keep themselves well hydrated and also move around, because pregnancy itself is a procoagulant state. So what does procoagulant mean? It means that the clotting tendency of blood increases during pregnancy. And this is for good reason, because after delivery, the patient quickly clots her blood and doesn't bleed excessively. So this is a preventive mechanism, a natural mechanism. Now, in COVID, once again, the clotting tendency of blood apparently increases. So in pregnancy, the woman has two factors if she gets COVID to increase the clotting of her blood, which is not a good thing. So pregnant women who are COVID positive must drink plenty of water, hydrate, keep themselves well hydrated, and also move around. And if the obstetrician thinks they are very high risk of getting clots, they may be advised blood thinning agents. So vitamin D and good hydration. Now, after 28 weeks, that's the risky time of pregnancy. So women who are in their late pregnancy now, it is very important for them to adopt, to wear masks when they go for checkups, not to leave the house, to stay at home, and practice hygiene, like what has been stated, and social distancing. This is all very important because they must try their best not to catch the infection.